Hello, I'm Tylah Tully, and today I'm joined by Singular Health Chief Operating Officer Martina Mariano. Martina, you've just reached a binding enterprise agreement with Provider Network Solutions. Walk us through the details of this deal.
Thank you, Tylah, and thank you for having me here. Yes, this is a significant milestone for Singular Health. We have just signed our first enterprise commercial contract in the United States with Provider Network Solution, or PNS, which is a managed service organization, an MSO, and they handle more than 3.7 million members. The total contract value is around 1.3 million US dollars, or roughly 2 million Australian dollars. And this includes the deployment of 1,000 Tridacom MD licenses across PNS's healthcare network, covering Florida, Texas, and Puerto Rico. Each annual PCP license is priced at US $800. And on top of that, we've secured $500,000 for the integration of diagnostic AI models to support clinical decision-making and also the creation of a comprehensive repository of radiological imaging data. Importantly, this agreement is the result of over a year of collaboration, following the successful completion of Phase 1 and 2 of our MOU, signed last November. And the solution we are delivering has been co-designed with PNS to help reduce duplicate imaging, which is a challenge that costs the US healthcare system around $30 billion a year.
I think you've just touched on it there, but the deal is for around 2 million Australian dollars. But what's the greater significance here?
Yeah, while the value of this contract is significant in itself, the true importance lies in what it represents for Singular Health's future. This is our entry point in the US market, and it provides us with a pathway to the broader PNS network, including groups like HOPCO and other nationwide MSOs, and it also positions us for national expansion. So to put this into perspective, there are 1.3 million physicians in the US, and each of them typically connects with around 19 MSOs, creating an estimated TAM, or total addressable market, of 19 billion US dollars. Now, this agreement strengthens our relationship with PNS, gives us a national deployment channel, and also lays the foundation for scaling through partnerships with other MSOs and health plans.
And can you tell us more about the healthcare problem being addressed here?
Yeah, the core issue that we are addressing is the lack of interoperability between healthcare systems, which leads to unnecessary duplicate imaging exams. Today, when providers don't have access to prior imaging because PACS systems are siloed across different facilities, patients often undergo the same scans again. This causes unnecessary radiation exposure, discomfort, delays in care, and significant added costs. For PNS alone, this represents 1.5 billion annual problem. Now, our Tridacom solution enables providers to search for and also retrieve and review existing imaging exams across any PACS connected to the MSO network. And this is possible because our solution is PACS agnostic, meaning that we can integrate regardless of the vendor. The images are accessed securely, backed by blockchain auditing, and they're also delivered quickly, so clinicians can make informed decisions and avoid unnecessary duplicate exams. The result is streamlined care, improved patient outcome, and also enhanced operational efficiency.
Finally, you also completed an $8 million placement. What will those funds be used for, and what else should investors look out for from Singular Health?
Yeah, we have successfully raised 8 million Australian dollars with support from high-quality institutional investors, high net worth individuals, and existing partners through a placement that was led by the Wallaby Group here in Perth. It is worth noting that PNS and Marina & Sons themselves subscribed for a combined $300,000, which demonstrates their confidence in our strategy. The funds are being used strategically to strengthen our balance sheet and support the national rollout of Tridacom in the United States, accelerate product development, and ensure that we have necessary working capital to deliver on our growth plans. Looking ahead, investors can expect further commercial progress in the US, both in the clinical and medical education sectors, the integration of new AI capabilities, and the expansion of our partnerships with MSOs and health plans nationwide.
Martina, it's been a pleasure. Thank you for joining us today.
Thank you for having me.
For more ASX news and analysis, subscribe below.